I never thought I'd be the person comparing notes on orthopedic dog beds at midnight, but here we are. Turns out caring for an aging pet, whether it's a dog or the guinea pigs I specialize in, means accepting that what worked at age 2 doesn't work at age 10. I'm Mariana Vasquez, and I've spent years watching friends navigate senior dog care while managing my own aging guinea pigs, and the parallels are striking. When my senior guinea pig, Mocha, needed softer bedding and lower water bottles, I realized something. Aging pets don't need less attention. They need different attention. And for dogs, those differences can mean the gap between years of comfort and years of preventable pain.
You're listening to Total Pet Parent Podcast. Quick heads up before we dive in. Everything you're about to hear is researched and written by actual experts, real people with real credentials, but the voice delivering it is AI generated. We're using technology to get solid, human-verified information to you in an accessible format. If you've been listening for a while, thank you. Having you show up episode after episode genuinely matters. And if this is your first time here, welcome aboard. We keep things practical around here, no fluff. New episodes come out every Monday, Wednesday, and Friday, so you'll have a steady stream of useful stuff. Let's jump into today's episode.
Senior dog care refers to the specialized attention, medical monitoring, nutrition adjustments, and lifestyle modifications required to support dogs as they enter their golden years. Unlike the boundless energy puppy phase or the steady adult years, senior dogs experience physical and cognitive changes that demand a different approach to daily care. The age at which a dog becomes senior varies significantly by size and breed. Small breeds under 20 pounds typically reach senior status around 10 to 12 years old, medium breeds between 20 and 50 pounds around 8 to 10 years, large breeds between 50 and 90 pounds around 6 to 8 years, and giant breeds over 90 pounds as early as 5 to 7 years. This variation exists because larger dogs age faster at a cellular level, something researchers at the American Veterinary Medical Association have documented extensively. When we talk about senior dogs becoming geriatric, we're not just marking a calendar date. Senior dog care means watching for subtle shifts, the slight hesitation before jumping onto the couch, the graying muzzle, the afternoon naps that last a bit longer. It's about adapting your routines before problems become crises. Now, let's talk about how senior dog care actually works. The mechanism behind effective senior dog care involves proactive monitoring, environmental adjustments, and preventative veterinary intervention. Unlike reactive care, waiting until something breaks down, senior dog care operates on the principle that early detection and gradual adaptation prevent suffering. Veterinary care shifts from annual checkups to biannual examinations for most senior dogs. These visits typically include blood work with a complete blood count and chemistry panel, urinalysis, blood pressure monitoring, and often thyroid function tests. The goal? Catching kidney disease, diabetes, thyroid disorders, and other age-related conditions before clinical symptoms appear. Your vet creates a baseline when your dog enters senior status, then tracks changes over time. A subtle creatinine increase might signal early kidney concerns, while rising alkaline phosphatase levels could indicate liver changes or Cushing's disease. Nutritional requirements change significantly as dogs age. Senior dogs often need fewer calories because their metabolism slows and activity decreases, but they need higher quality protein to maintain muscle mass, despite reduced absorption efficiency. They also benefit from added joint-supporting ingredients like glucosamine and chondroitin, and sometimes increased fiber for digestive health. The best dog food for senior dogs typically contains around 18 to 25% protein, higher than many people assume, moderate fat, that's 5 to 10% lower than adult formulas, and enhanced levels of omega-3 fatty acids for cognitive and anti-inflammatory benefits.
Environmental modifications form the practical backbone of senior dog care.
This means orthopedic beds with memory foam or supportive bolsters, ideally 4 to 6 inches thick for proper joint cushioning. It means non-slip flooring solutions like yoga mats or textured runners on hardwood, ramps or stairs with 18 to 20-degree inclines for furniture or vehicle access, raised food bowls positioned at chest height to reduce neck strain. I watched my friend install a simple $30 ramp next to her couch for her 11-year-old Labrador, Max, and the relief on his face was immediate. No more painful jumping. Exercise routines require recalibration. Rather than one 45-minute walk, senior dogs often do better with 2 or 3 15 to 20-minute outings. The intensity drops, but frequency maintains muscle tone and mental stimulation. Swimming and controlled leash walks on soft surfaces like grass or dirt trails replace rough-and-tumble dog park romps. You're aiming for consistent, gentle movement rather than sporadic, intense activity. Cognitive engagement becomes crucial as dogs age. Interactive feeding toys, scent work games, and short training sessions of 5 to 10 minutes keep neural pathways active. Just like my guinea pigs benefit from foraging opportunities that engage their natural behaviors, senior dogs need mental stimulation tailored to their physical limitations. A dog who can't chase anymore might excel at find-it games, where treats are hidden around a house. Moving on to why senior dog care matters so much. The practical significance of dedicated senior dog care extends far beyond simply extending lifespan. It's about maintaining quality of life during your dog's final years. Without proper senior dog care, dogs experience unnecessary pain from unmanaged arthritis, confusion from undiagnosed cognitive decline, and distress from preventable medical conditions. Early intervention dramatically improves outcomes. Dogs whose owners implement mobility management at the first signs of stiffness, rather than waiting until the dog can't rise from the floor, maintain better muscle strength and joint function. A study published by veterinary orthopedic specialists found that dogs starting joint supplements and modified exercise routines at age 7 to 8 showed 40% less cartilage degradation by age 10 compared to dogs who began intervention at age 9 to 10. The financial reality matters too. Proactive senior dog care costs more upfront, those biannual vet visits, the higher quality food, the supplements, but it prevents catastrophic emergency expenses. I've seen friends spend $3,000 to $5,000 on emergency surgery for conditions that might have been managed with $500 to $800 in annual preventive care. It's not unlike how regular guinea pig vet checks catch early respiratory issues before they become life-threatening pneumonia.
The emotional component deserves acknowledgement. Senior dog care honors the relationship you've built. The dog who protected you during anxiety attacks, who greeted you after every bad day, who learned 47 commands just to make you smile. That dog deserves your attention to their comfort. Setting up comfort accommodations for your senior dog isn't sentimental, it's ethical reciprocity. Let's get into the key aspects of senior dog care, starting with nutrition and weight management. Senior dogs face a tricky metabolic paradox. They need fewer calories but more nutritional density. A sedentary 10-year-old golden retriever might need 20 to 30% fewer calories than at age 3, but requires higher quality protein sources to counteract age-related muscle wasting, which is called sarcopenia. Look for senior formulas with named meat proteins, chicken, beef, salmon, not just meat meal as the first ingredient. Moderate fat content of 8 to 12% for most seniors, lower if weight loss is needed, and added joint support compounds. Glucosamine levels should be around 300 to 400 milligrams per kilogram of food, chondroitin around 100 milligrams per kilogram. Many premium brands also include omega-3 fatty acids, specifically EPA and DHA from fish oil, at therapeutic levels. Look for at least 0.3 to 0.5% on a dry matter basis.
Some senior dogs benefit from wet food or moistened kibble. Dental disease often makes dry food painful, which we'll get to in a minute, and moisture content helps dogs with reduced thirst drive stay hydrated. If your dog's been on dry food for years, you'll want to switch gradually to prevent digestive upset. Weight management becomes critical. Even 2 to 3 pounds of extra weight on a 40-pound dog places significant stress on arthritic joints. I tell people to think of it like carrying a backpack all day. Those extra pounds accumulate as joint pain by evening. Now let's talk about joint health and mobility support. Osteoarthritis affects approximately 80% of dogs over age 8, according to veterinary orthopedic data. The cartilage that cushions joints wears down, bones grind together, inflammation increases, and pain limits movement. This isn't just about limping, it's about a dog who stops greeting you at the door or refuses stairs they once bounded up. Multimodal pain management works best. That means non-steroidal anti-inflammatory drugs like carprofen or meloxicam prescribed by your vet, joint supplements containing glucosamine, chondroitin, and MSM, omega-3 fatty acids at therapeutic doses, aim for 50 to 100 milligrams of combined EPA and DHA per pound of body weight daily, and alternative therapies like acupuncture or laser treatment.
Physical therapy and controlled exercise maintain muscle mass that support weakened joints. Hydrotherapy, which is swimming or underwater treadmill sessions, provides resistance training without joint impact. Even a 12-year-old German Shepherd with severe hip dysplasia can benefit from 10-minute gentle walks twice daily. Environmental modifications reduce daily joint stress. Orthopedic beds with memory foam or egg crate foam at least 4 inches thick, carpet runners or yoga mats on slippery floors, ramps with gradual inclines, maximum 20 degrees, raised food and water bowls. I helped a neighbor set up what we jokingly called the senior suite for his 13-year-old beagle. Cushioned everything, no stairs, all bowls raised. The dog moved more freely within days. Dental health management is another critical aspect. Periodontal disease affects 80 to 90% of dogs over age 3, and it's even more prevalent in seniors. This isn't just about bad breath. Untreated dental disease causes chronic pain, difficulty eating, and bacteria that can spread to the heart, liver, and kidneys through the bloodstream. Senior dogs need regular dental examinations, at minimum during those biannual vet visits, and professional cleanings under anesthesia when necessary. Yes, anesthesia carries slightly higher risks for seniors, but modern protocols with pre-anesthetic blood work, IV fluids, and careful monitoring make it safer than ever. The alternative, living with infected, painful teeth, causes greater suffering. Home dental care matters tremendously. Daily toothbrushing with pet-safe toothpaste, never human toothpaste, which contains toxic xylitol, dental chews approved by the Veterinary Oral Health Council, water additives that reduce plaque formation. Dogs with severe dental disease may need wet food or softened kibble. No one should have to chew on painful teeth. Cognitive health and mental stimulation deserve attention too. Canine cognitive dysfunction, essentially doggy dementia, affects 14 to 35% of dogs over age 8 and up to 68% of dogs 15 to 16 years old. Signs include disorientation, like staring at walls or getting lost in familiar spaces, altered sleep-wake cycles, such as pacing at night and sleeping all day, house soiling, despite being house-trained, and reduced interaction with family. Mental enrichment slows cognitive decline, puzzle feeders that make dogs work for meals, scent games where you hide treats around the house, short training sessions teaching new tricks. Yes, old dogs can learn new tricks, and it's excellent neural stimulation. Maintained social routines that provide structure. Supplements and medications can help. Omega-3 fatty acids support brain health. Medium-chain triglycerides, or MCTs, provide alternative brain fuel.
Prescription medications like selegiline improve neurotransmitter function. Antioxidants, including vitamins E and C and selenium, combat free radical damage. Routine becomes more important as dogs age. Feed at the same times, walk the same routes, maintain predictable schedules. Senior dogs with cognitive changes find comfort in consistency, kind of like how my older guinea pig, Mocha, would get agitated if I rearranged her cage furniture. Regular health monitoring forms the foundation of senior dog care. Biannual veterinary examinations are essential. These visits typically include a physical examination with attention. Supplements and medications can help. Omega-3 fatty acids support brain health. Medium-chain triglycerides, or MCTs, provide alternative brain fuel. Prescription medications like selegiline improve neurotransmitter function. Antioxidants, including vitamins E and C and selenium, combat free radical damage. Routine becomes more important as dogs age. Feed at the same times, walk the same routes, maintain predictable schedules. Senior dogs with cognitive changes find comfort in consistency, kind of like how my older guinea pig, Mocha, would get agitated if I rearranged her cage furniture. Regular health monitoring forms the foundation of senior dog care. Biannual veterinary examinations are essential. These visits typically include a physical examination with attention to heart murmurs, lymph node enlargement, and abdominal masses, blood work, including a CBC and chemistry panel, plus thyroid function, urinalysis to detect early kidney disease or diabetes, and blood pressure monitoring, since hypertension is common in seniors. Home monitoring helps you spot changes early. Weekly body condition assessments, run your hands along your dog's ribs. You should feel them easily, but they shouldn't protrude. Daily observation of appetite, water intake, urination and defecation patterns, energy levels, mobility, like any new stiffness or limping, and behavior changes. Keep a simple health journal. I learned this from tracking my guinea pig's weights weekly. Patterns emerge that you'd miss relying on memory alone. Note when your dog seems more tired than usual, when they start drinking more water, when they hesitate on stairs. Share this log at vet visits. Your observations provide crucial context that lab values alone can't capture. Specialized supplements round out the toolkit. Joint supplements typically combine glucosamine at 300 to 500 milligrams per 25 pounds of body weight daily, chondroitin at 200 to 400 milligrams per 25 pounds, MSM, which is methyl sulfonyl methane, and sometimes green-lipped mussel extract, or ASU, which is avocado and soybean unsaponifiables. These compounds support cartilage health and reduce inflammation, though effects take 6 to 8 weeks to become noticeable. Cognitive support supplements include omega-3 fatty acids, with DHA particularly important for brain health, medium-chain triglyceride oil, phosphatidylserine, and antioxidants. Some products contain a blend marketed as brain support formulas. Digestive enzymes and probiotics help senior dogs with reduced digestive efficiency. As dogs age, they produce fewer digestive enzymes and beneficial gut bacteria decline. Supplementation can improve nutrient absorption and reduce gas or loose stools. Not every dog needs every supplement. Work with your vet to identify which supplements address your dog's specific issues. There are different approaches to senior dog care worth understanding.
Conventional veterinary medicine relies on evidence-based treatments, prescription medications, surgical interventions, diagnostic imaging, and laboratory testing. This approach excels at diagnosing specific diseases and providing targeted treatment like antibiotics for infections, insulin for diabetes, or chemotherapy for certain cancers. Integrative or holistic care combines conventional medicine with complementary therapies. Acupuncture for pain management and mobility. Yes, dogs tolerate needles remarkably well. Physical rehabilitation, including hydrotherapy and therapeutic exercises. herbal supplements under veterinary guidance, massage therapy for muscle tension and circulation. Palliative and hospice care focuses on quality of life when curative treatment isn't possible or desired. This includes aggressive pain management, nutritional support, emotional comfort, and family guidance about end-of-life decisions. It's not about giving up, it's about prioritizing comfort over lifespan extension. Preventative care models emphasize early intervention before problems become severe, starting joint supplements at age 6 to 7 before arthritis symptoms appear, implementing senior dog food formulas when dogs reach breed-specific senior age, establishing baseline health markers at age 5 to 6 for comparison as dogs age. Most senior dogs benefit from a combination approach, conventional medicine for disease management plus integrative therapies for overall wellness. My friend's 12-year-old border collie takes prescription arthritis medication, gets weekly acupuncture sessions, and follows a strict exercise modification routine. All three components work together. Let me address some frequently asked questions about senior dog care. When should you start senior dog care for your dog? You should begin senior dog care preparations when your dog reaches approximately 75 to 80% of their expected lifespan. That's around age 6 to 7 for large breeds, 8 to 9 for medium breeds, and 10 to 11 for small breeds. This timing allows you to establish baseline health markers before significant aging changes occur, implement preventative joint support and diet modifications early enough to make a difference, and create a relationship with veterinary care focused on senior health monitoring. Starting senior care doesn't mean your dog is old. It means you're being proactive about maintaining their quality of life through their golden years.
How often should senior dogs see the veterinarian? Senior dogs should have veterinary examinations every 6 months, twice yearly, rather than the annual schedule used for healthy adults. These biannual visits allow veterinarians to track subtle changes in blood work values, blood pressure, and physical examination findings that might indicate emerging health issues like kidney disease, diabetes, thyroid disorders, or heart disease. Some dogs with chronic conditions like arthritis, diabetes, or cognitive decline may need quarterly visits or more frequent check-ins for medication adjustments. The increased frequency isn't about spending more money unnecessarily. It's about catching problems when they're still manageable, rather than waiting for crisis situations. What are the most important supplements for senior dogs? The most important supplements are joint support compounds, including glucosamine, chondroitin, and MSM at therapeutic doses based on body weight, omega-3 fatty acids from fish oil at 50 to 100 milligrams of combined EPA and DHA per pound daily for anti-inflammatory and cognitive benefits, and sometimes probiotics for digestive health and nutrient absorption. Some senior dogs also benefit from cognitive support supplements containing medium-chain triglycerides and phosphatidylserine, particularly if they show early signs of confusion or altered sleep patterns. However, no supplement is universally necessary. Your dog's specific needs depend on their health status, existing conditions, and diet quality. Always discuss supplements with your veterinarian before starting them, as some can interact with medications or aren't appropriate for certain health conditions. Can senior dogs still exercise, and how much is appropriate? Senior dogs absolutely should continue exercising, but the type, intensity, and duration need adjustment based on their mobility and stamina. Most senior dogs thrive on 2 or 3 shorter walks of 15 to 20 minutes each, rather than one long outing, allowing rest between exercise sessions to prevent joint pain and fatigue. Low-impact activities like swimming, gentle leash walks on soft surfaces, and controlled indoor movement are ideal, while high-impact activities like jumping for frisbees, rough play with younger dogs, or long hikes should be reduced or eliminated. The goal is maintaining muscle mass that supports weakened joints and providing mental stimulation through environmental exploration while preventing the next day soreness and stiffness that comes from overdoing it. Watch your dog's body language. If they're stiff or reluctant the day after exercise, you've done too much.
How do you know if your senior dog is in pain? Senior dogs often hide pain instinctively, so you need to watch for subtle behavioral changes. Reluctance to jump on furniture, climb stairs, or rise from lying down. Altered gait like limping, bunny hopping, or shortened stride. Reduced activity or playfulness compared to previous patterns. Changes in appetite or interest in favorite treats. Irritability or aggression when touched in certain areas, excessive panting or restlessness, especially at night, postural changes like a hunched back or tucked abdomen. Senior dogs with chronic pain may also sleep more, but appear uncomfortable, shift positions frequently, or avoid activities they previously enjoyed. If you notice any combination of these signs, consult your veterinarian. Pain management options have expanded dramatically in recent years, and no dog should live with untreated discomfort during their golden years. Your senior dog isn't broken, they're experienced. Those gray whiskers and slower mornings represent years of loyalty, companionship, and unconditional love. Senior dog care isn't about fighting the inevitable aging process, it's about adaptation. Softer beds for achier joints, shorter walks that still provide joy, regular vet visits that catch problems early, and the quiet dignity of letting your dog age comfortably in the home they've always known. The practical stuff, the orthopedic beds, the joint supplements, the ramps, matters tremendously, but so does the attention you pay to those subtle shifts, the moment they start hesitating before stairs. The night they seem confused about which door leads outside. The morning they don't bound to greet you. Senior dog care means seeing your dog clearly, accepting what's changing, and responding with intention rather than denial. My guinea pig, Mocha, taught me that aging doesn't mean declining, it means transforming. She explored her space differently at 7 than she did at 2, but her enthusiasm for fresh cilantro never wavered. Your senior dog deserves that same respect, adaptations that honor their changing needs while celebrating what remains unchanged, that spark of personality that made you fall in love in the first place.
Thanks for listening to this episode of Total Pet Parent Podcast. We've got new episodes coming at you every Monday, Wednesday, and Friday, so there's always something on deck. If you found this episode valuable, I'd really appreciate it if you could leave a 5-star rating and write a quick review. It sounds like a small thing, but it genuinely helps other dog owners discover the show when they're searching for answers. And go ahead and hit subscribe or follow so you get a notification the second a new episode drops. I'll see you in the next one.